Hello everyone, today I'll be talking about a great opportunity for working in the healthcare sector as a laboratory technician with Trillium Health Partners in Mississauga, Ontario. Welcome to Trillium Health Partners. Trillium Health Partners is the largest community-based system of hospitals in Canada, found in Mississauga and Western Toronto. This system includes three main sites: the Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. All sites provide a full range of services, including acute care and a variety of community-based specialized programs. Trillium Health Partners is also academically affiliated with the University of Toronto as it is a teaching hospital. The Credit Valley Hospital offers a plethora of core clinical programs in emergency, mental health, rehabilitation, and pediatrics. It also offers several specialized programs for oncology, clinical genetics, maternal child care, and more. The Mississauga Hospital offers several regional programs, including services for stroke, cardiovascular health, neurosurgery, and many more. The Queensway Health Centre contains a model ambulatory care site, providing community residents with access to convenient outpatient services. This centre is also the site of rehabilitation services, a complex continuing care unit, the Betty Wallace Women's Health Clinic, and the Kingsway Financial Spine Centre. Now I'll be moving on to what is a laboratory technician. A laboratory technician is someone who works hands-on in laboratories, performing practical work in several diverse fields of study. Where do lab technicians work? They may work in laboratories for healthcare, like in hospitals. They may work in industry, research, or at educational institutions. In a hospital setting, lab technicians must be familiar with many different techniques related to the services conducted by the labs. This can include testing related to cytology, surgical pathology, immunohistochemistry, histology, microbiology, and blood banking. These tests may be crucial in helping to determine a diagnosis or treatment plan for patients. Lab technicians are a valuable member of a great team of professionals working to provide services for patients in their hospitals. I will now be sharing some studies which prove the significance of lab technicians working in a hospital setting. The first study by Abdullahi et al. 2020 is titled The Comparison of Patient-Collected and Lab Technician-Collected Nasopharyngeal and Oropharyngeal Swabs for Detection of COVID-19 by RT-PCR. The goal of the study was to determine if patient-collected samples were sufficient for successfully detecting SARS-CoV-2 respiratory disease, or COVID-19, to eliminate the need for lab technicians to come into contact with patients who may have the highly contagious infection. This study was done by randomly selecting 50 adult patients who had a clinical diagnosis of COVID-19 at the Imam Khomeini Hospital in Iran. Two sets of nasopharyngeal and oropharyngeal swabs were collected, one by the lab technician and the other by the patient. A COVID-19 rapid real-time polymerase chain reaction was conducted to test these samples for COVID-19. For the results, there were inconsistencies between the patient-collected and the lab technician-collected samples. For the patient-collected samples, only 28% of the nasopharyngeal swabs successfully revealed a positive result, and only 36% of the oropharyngeal swabs successfully revealed a positive COVID-19 result. When we refer to the lab technician-collected samples, 44% of the nasopharyngeal swabs and 40% of the oropharyngeal swabs successfully revealed a positive COVID-19 result. Overall, the percentage agreement between the samples taken by the technician and the patients was 76%. With a p-value of 0.001, this study concluded that the lab technician-collected samples cannot be replaced by patient-collected samples with regard to COVID-19 RT-PCR. This study shows the importance of laboratory technicians following the regulations needed for successful diagnostic screenings. They are trained and certified for the position and therefore play a crucial role for the successful diagnosis of COVID-19. For the next study by Padini et al. 2022, the title of the paper is Screening Platelet Function in Blood Donors. Hemostatic disorders refer to conditions in which blood clotting is irregular due to defective platelets in the blood. Hemostasis is not pre-assessed in blood donors, so platelet function is not taken into account when blood is being donated. This can result in transfusion of blood with dysfunctional platelets, which may contribute to the lack of necessary clotting factors in recipients. For this study, Petty et al. 2022 wanted to explore how many blood donors may unknowingly have any such hemostatic disorders. For the study, a group of blood donors were assessed through a bleeding screening questionnaire to screen for possible platelet disease. Donors with suspected irregularities were referred to a more thorough platelet analysis. This study had 2,629 blood donors as participants. After the initial questionnaire, 88 donors, which is about 3.6%, had a bleeding score indicative of a potential bleeding disorder. After further testing, it was found that 15 of the donors had a laboratory evaluation of hemostasis, and approximately 1 out of 2,000 donors, or 0.05%, displayed characterized platelet granule defect. Overall, this study concluded that using a bleeding questionnaire, such as this one displayed here, is a valuable tool to screen for platelet defects in potential blood donors. One of the responsibilities of lab technicians includes the handling and screening of such blood samples. This study supports the need for lab technicians to become more involved with assessing blood before it is donated. The final study by Mamek et al. 2016 is titled Hospitalized Patients with Heart Failure and Common Bacterial Infections, a nationwide analysis of concomitant Clostridium difficile infection rates and in-hospital mortality. It has been observed that patients with heart failure, or HF, are often also hospitalized with common bacterial infections. This study explores whether patients with HF experience concomitant Clostridium difficile infection, or CDI, more often than patients without HF, and whether or not CDI affects their mortality rate. Data was taken from hospitals across the United States in 2012. This data was used to determine the rate of CDI and associated inpatient mortality for patients with comorbid HF and urinary tract infection, UTI, pneumonia, PNA, or sepsis. From the 5,851,582 patients that were discharged with a diagnosis of UTI, PNA, or sepsis, 23.4% also had a discharge diagnosis of HF. Furthermore, the Clostridium difficile infection rates were higher for patients with heart failure with an odds ratio of 1.13 or 13% higher in patients with heart failure. Also, among the heart failure hospitalizations with UTI, PNA, or sepsis, those with Clostridium difficile infection had higher in-hospital mortality than those without CDI, with an odds ratio of 1.81 or 81% higher. Thus, Mamek et al. 2016 concluded that despite adjusting for other known risk factors for CDI, HF is associated with higher CDI rates in hospitalized patients. Overall, lab technicians may be able to help with testing for CDI in patients with HF early on in diagnosis to ensure better quality care for patients. I will now be moving on to the requirements to becoming a laboratory technician at Trillium Health Partners. There is only one concrete requirement necessary to qualify for this job: successfully completing an accredited laboratory or medical assistant course or an equivalent. There are many institutions across Canada that offer such courses, which may take around 1 year to complete. Having recent hospital experience is a good asset for acquiring this position, as being involved with the hospital environment may help you understand what to expect at this job setting. Another bonus for future lab technicians is having a certification from the Ontario Society of Medical Terminology or the Canadian Society of Medical Laboratory Science. Other important skills for this job include having good communication skills, interpersonal skills, problem-solving skills, and critical thinking skills. Overall, following the path to becoming a laboratory technician is a great way to become involved in the healthcare sector of biomedical sciences. Thank you for watching.